All right, kia ora, good afternoon everybody. Today I'm going to give an update on the vaccination program, share some of the changes that we're making to the border worker testing register, and then we'll take your questions after that. But first I'm going to ask the Director General of Health to provide an update on recent cases.
Thank you, Minister. Kia ora koutou katoa. So, as the Minister said, an update on recent cases. What I can say, there are no new cases in the community today. And regarding our case B, who had a number of casual plus, close and close plus contacts, all the remaining tests are in for those people and they're negative. So we just have the one additional case, which was case C that we announced a few days ago. There are two new positive cases of Covid-19 in managed isolation since yesterday. One of these arrived from India and tested positive on day 3. The other arrived from Pakistan, testing positive on day 7. And this latter case is a contact of an earlier reported case. So our 7-day rolling average of new cases detected at the border is 8. You would have noticed the numbers coming down over the last few days, and we expect that average to continue to drop. There are additional 3 recovered cases, so our total number of active cases today is 101. And our total number of cumulative cases, confirmed cases, is 2,233. Other case details will be on the Ministry's website after the stand-up. So just a couple of little updates around the Pfizer-BioNTech vaccine before show and tell about some new features on the NZ COVID Tracer app. Firstly, on the freezer storage side of things for our Covid-19 Pfizer vaccine. Currently in our Auckland freezers we have capacity for, the total capacity is 760,000 doses can be stored there. We have an additional 2 freezers in Christchurch which aren't being used at the moment but which could be if needed. Our currently we have 315,000 doses in our Auckland freezers and we have more freezers on order for the end of June. So we have plenty of freezer capacity. Importantly though, MedSafe has approved the ability for us to store the Pfizer vaccine at about -20 degrees, and Pfizer has approved this as well, which is normal freezer temperature. And the vaccine can be stored at that temperature of between -15 and -25 for up to 2 weeks before it is either used, or it can be even returned to the -70 degrees one further time before it is used, defrosted and used subsequently. So this ability to use that -20 for 2 weeks gives us some additional options around the logistics of getting the vaccine out, particularly to more remote and rural areas. So that's a great development, and that is feeding right into our ongoing planning with our district health boards. We're certainly remaining confident about the progress with the vaccination rollout, and the Minister will talk more about that shortly, including across the Auckland region, where things are rapidly gathering momentum. There's a new vaccination clinic opening today at Waitakere Hospital in Henderson, and last week the first Auckland City Centre vaccination site opened in the Atrium Shopping Centre on Elliott Street. That site, which had previously been providing vaccinations for MIQ staff in the CBD, will be able to vaccinate around 500 people today. Last week we also had our first marae-based clinic open at Manurewa Marae. It's vaccinating up to 300 people per day, and our Pasifika-focused vaccination centre also opened last Thursday in Otara in South Auckland, currently doing around 300 vaccinations a day, but able to scale up from that as well. I do want to point out that at the moment, vaccination at all those centres is by invitation only, but it's great to see the volumes of people who are going through them all. And finally, the New Zealand COVID Tracer app, the latest release has a number of new features, including some of the national statistics available for people to see on the app, a flashlight for scanning, so the flashlight automatically comes on if it's nighttime and you are scanning in, and a reminder to keep your diary complete, as you may have noticed when you've been assiduously scanning in over recent days. Some of you may also have noticed, if you have been scanning every day for 14 days, that there is a new symbol that comes to provide extra motivation for you. You can get what is known as the swirl symbol if you complete 14 days out of 14. I'm on 13 days. The Minister himself can tell you what number he is on. and why, but hopefully many of you are working towards or have already achieved swirl status in your scanning in. So we are still seeing good use of the app, which is great. I do want to keep encouraging people to use it. It is an essential part of our contact tracing tools, and if you don't have the app or are unable to use it, please do keep a manual diary of where you have been. Thank you, Minister.
I can share with you all that I'm currently on 11 out of 14 days, Good Friday and Easter Sunday being 2 of the days when I didn't scan any QR codes, having not been anywhere where there were QR codes on those days. Anyway, moving on. Moving on to vaccines. As of today, we have delivered 135,585 of doses of the Pfizer vaccine across New Zealand. In the last 24 hours, we delivered 7,695 vaccinations, bringing the weekly total across the last 7 days to 34,378 people. Of those vaccines delivered to date, 43% of those have been delivered in Auckland. 19% of the people in Auckland who have had the vaccine are Māori or Pasifika. A large-scale vaccination centre is opening today in Mount Wellington, which is the second one to open up that's capable of vaccinating more than 1,000 people per day when it's operating at full capacity. Initially, that new centre is going to be used to vaccinate St John's ambulance staff and the police. It will be by appointment only initially. Many of those who they'll be targeting in the first instance are already based in Mount Wellington. Now, I know there has been a lot of interest in the vaccination program and the numbers associated with the vaccination program in particular. So I did want to give some greater detail around the first wave of the vaccination program that takes us through to the end of June. So today we're releasing a breakdown by District Health Board and by week that shows that over the next month, the next period of time leading to the end of June, so that's basically the next 12 weeks or so, we'll be delivering more than 1 million additional Pfizer doses to New Zealand's priority groups as set out in our sequencing framework. This is based on the discussions we've had with district health boards around what they are geared up to deliver. The breakdown provides a DHB by DHB number on a week-to-week basis over the next 3 months. We'll be providing weekly updates against the numbers provided in that forecast. It shows the planned vaccinations each week, and it will ultimately be the rolling total that we'll give you each Wednesday when we release the data. Media have also been invited to a more detailed briefing tomorrow to talk through any questions around the detail of that. The DHB forecast numbers show that we're on track to be well into Group 3 in our 4-group sequencing framework by the time we hit that million dose mark towards the end of June. Group 3 starts in late May and it includes our populations over the age of 65 and those across the whole population who have underlying medical conditions. What we've asked DHBs in putting these forecasts together is to be really upfront about what they think they will deliver over the next month. That way we can be sure that we're targeting areas of need or where we have any concerns, making sure that we're getting resources and vaccines into the right place at the right time and to ensure that we can continue to get a good uplift in our vaccination numbers. Moving on to our managed isolation facilities, the latest numbers that we have are that almost 88.5% of our MIQ workforce had been vaccinated as of last night. So to put those into actual numbers, 4,497 is the current number of people in the MIQ workforce. 513 of those are still to receive their first vaccine. However, I'm assured that at least a quarter of those are booked in to get their first vaccine in the next couple of days. That will take us well above the 90% mark overall for MIQ. You'll see in the breakdown that we've released today, this breaks down the MIQ workforce broadly by group, including hotel workers, public servants, security firms, and district health board staff working in MIQ. It also provides a regional breakdown of those as well. And we'll be aiming to provide a weekly update against those numbers as well so that you can see how we're tracking with that workforce. We have got some number crunching happening around the wider border workforce. That includes a much larger number of employers because it includes everything from truck drivers who may have some interaction with ships coming in and out of the port, through to people working in small businesses who operate airside at the airports. So that work is going on at the moment to crunch those numbers down, and we'll be aiming to provide a detailed breakdown of those within the next week or so. As I've said previously, from Monday, those difficult conversations have begun with employees who have jobs on the front line who have not been vaccinated. By the end of the month, there will be nobody working in those frontline roles who hasn't had at least one dose, the first dose of the vaccine. With regard to the border worker testing register, I have signed an order last night which will make it mandatory for employers to use the border worker testing register from the 27th of April. All relevant border workers continue to have an obligation to report for and undergo COVID-19 testing, and all employers have had an obligation to keep a record of this. Moving to a more standardised approach will give us better oversight of that. We've done this to further strengthen our overall border response to COVID-19. Roughly a third of employers, covering about 60% of the relevant border workforce, have been using the register to keep track of their staff's testing. Other organisations have chosen to use their own registers to comply with the testing order. The new order makes it a requirement that all of those staff in the relevant roles are now being covered by the one register. So the register notifies workers 3 days before they are due to be tested that they need to have a test. That comes through via text message. Employers are notified 2 days before a worker is required to be tested so that they can work with the employee to make sure that they are getting their testing. This means that both the workers and the employers are able to keep track of testing and make sure that the obligations set out in the required testing order are being met. The new order also captures additional groups that will need to be regularly tested as a result of the lessons that we learned from the recent Sky Chef case. You'll recall that this was a laundry worker who was being regularly tested but wasn't required to be tested. As a result of further work, we have extended the required testing order to a small number of additional workforces, and that's captured by the latest order. It also increases the frequency in which managed isolation and quarantine workers need to be tested. At the moment, those working at the jet park need to be tested weekly. Those working in other MIQ facilities need to be tested fortnightly. They will all now need to move onto a weekly testing cycle. Finally, looking to 11:59 p.m. on the 18th of April on Sunday, when the Trans-Tasman bubble opens up, we are expecting an increase in the available rooms that we have in our managed isolation facilities, and we are already seeing that. We're seeing a downturn in demand from countries other than Australia, and then obviously we're seeing people who were booked in to go into managed isolation facilities from Australia rescheduling their flights to after next Sunday, or after Sunday, so that they can avoid that on arrival in New Zealand. That is freeing up a number of rooms within MIQ. As I've said, we won't have a complete like-for-like availability swap, but there are more rooms available. And as of today, there's a good spread of rooms available over the next few months for New Zealanders looking to return home. It is a good time to take up that opportunity to come back to New Zealand. Also, those who have been affected by the current suspension of travel from India, there are rooms available for them as they look to rebook their flights, and they shouldn't have difficulty in securing rooms through MIQ to align with their new flights. So based on that, happy to open up for questions.
How is it that Case B, a frontline border worker, hadn't been tested since November?
So as I've gone through with the border worker testing register, in this particular case, that was an employer that was using a combination of the border worker testing register and their own internal record keeping. The advice that I have had at the moment is that the individual concerned was supplying information to their employer that they had been regularly tested. At this point, it appears that that's not been the case. So there is an investigation going on about that. The employer should have been able to verify whether the person had been tested or not. So the investigation will look at exactly how that came to be for this particular case.
So the person was lying to their employer about being tested?
Look, there's an investigation going on about that, so I don't want to get into all of the details and ins and outs about that, but it does appear that some of the information provided by the individual to their employer doesn't match up with the actual records of tests taken.
How long had this information that the employee had been given to, apparently wrong information that the employee had been given to their employer, how long had that been going on for?
How long have we known about, or how long it had been going on for?
How long had it been going on for?
So my understanding is the most recent swab sample, other than the positive test result, was back in November, so that has been absolutely matched to that individual. In terms of when we found out about it, I think it started to become apparent that there was something not quite right about this over the last week or so. There is a process that we go through to verify all those records, to make sure that there aren't duplicate NHI numbers, for example, complicating the process, to make sure that the data is all correct.
So who's responsible for this? Is this the employer? Is this MB?
Well, ultimately, individuals do have a responsibility to ensure they are being tested. They know they are required to be tested. They do get regular reminders if they haven't been tested, through text messages to say you're due for a test, you need to come in and have a test. The employers also have a responsibility as the PCBUs, the people conducting a business undertaking, under health and safety law, they have the responsibility, and under the testing order, to make sure that their staff are being regularly tested.
Are you concerned if this person was lying about their testing history? Are you concerned that they were lying about contact tracing and also the reasons why they missed their vaccination appointments?
A very thorough contact tracing process has been undertaken here, and you'll see that it has revealed some locations of interest. We've published those locations of interest. Ultimately, I'm confident that we're getting the information that we need to be able to identify any further public health risk that might flow from this case.
Could this person face any charges or prosecution?
As I said, there's an investigation happening at the moment, and I don't want to get ahead of that investigation process.
No, that KSB was reluctant to help, and that the police...
We'll come into the front and then we'll come to you, Jane.
Sorry, mine's just a follow-on. Can you confirm that the police were called in to help elicit information about contact tracing of the person who's reluctant to provide information?
Yes.
And are there any penalties that the person can face because of that?
Ultimately, non-compliance with the order can be people who are not complying with COVID-19 orders. At the moment, they can have a fee of $300 or a fine of $1,000. The fine is obviously subject to a judicial proceeding, whereas the fee can be an instant fee. So, but at this point, that's hypothetical, because there's, before any fees or fines were considered, there needs to be a thorough investigation process, and that's what's happening at the moment. I said I'd come to Jane.
MB told us today that they were going back to the employer, First Security, to triangulate or check against that data. First Security has told us this week they send all of their information to the National Ministry of Health Register for all employees. What extra information then could you possibly get if they are saying that they've already using the register and have sent everything to it?
Like I said, an investigation process is really important here to make sure that we're absolutely clear about what information's been provided to whom and who verified what, and that's what the investigation will reveal. And it'll also reveal if there were any issues with data matching. Sometimes there are issues around data matching, but the investigation so far has suggested that would not account for the gap between November and April.
Perhaps, could I comment, Minister, just generally on that? So yes, the border worker testing register is built up from data from the employers. In the case of, for example, the public service people working in the MIQs, that data automatically is populated across by the MIQ team. So the employer, in this case, yes, employer had been providing the data to the border worker testing register, but was also keeping its own record of the testing as being told by the employee. The key additional functionality that is there is that employers can go in and look in the border worker testing register to, if they have provided information about employees, and look and see when the last time was that a border worker was tested.
And what difference will making that register mandatory make, and would that have prevented this from happening in terms of, I suppose, giving authorities a stronger arm to actually put pressure on employers if if they're worried about the information?
I think there are two things that will make a difference. One is making the use of the testing register mandatory. The other is across our MIQ facilities, the sign-in and sign-out process has been standardised as well, and we're working on making sure that the data supplied by those two systems matches up. So all of those of you who have visited large-scale workplaces, regardless, will be familiar with the sign-in process. You know, many firms now use an iPad where you sign in when you get there. MIQ facilities have that, and what the team are working on is making sure that the data of who's on site at any given time is clearly matched against the testing register.
If you're making it mandatory for people to get testing, wouldn't the logical step have been to say, actually, and you need to report it, and you need to report it accurately to one central point as well?
Ultimately, we worked our way through a system to make sure people were being tested. We continue to look at ways to refine that. There are fewer employers working in the space now than there were in the beginning, so the number of contracted workforces is now smaller than it was before because we have consolidated and so on. But we have been talking about a system that involves a lot of employers. Now, across MIQ, that number has gone down. Across the overall border, there's still a very large number of employers. So that is quite a complex beast to manage in terms of the data management part of that process.
There is no single source of truth for border worker testing until the 27th of April.
Not necessarily. So the border worker testing register does record, as I said in my introductory remarks, quite a significant proportion of the people who are being regularly tested. But employers will also maintain their own records as well. Some small firms won't be using the register because they didn't feel they needed to. So if you're a small retailer working airside, for example, you might only have a handful of employees and you might just be keeping a track of exactly who's been tested and when they've been tested without the need to use a register. Bigger employers obviously will have had some other more sophisticated system for keeping track of who has been tested. But the responsibility for compliance sits with the individuals and sits with their employers.
Why wait 2 weeks for it to be mandatory?
To make sure that people can actually comply. You have to have a process to go through where they get their data into the register and where they're able to comply. Those employers that are not part of the use of the register regularly are already in the process of transitioning to it because we've signalled this to them previously. This is the window of opportunity they now have is just to make sure that they're actually being compliant.
Yes. Border workers.
The trouble with this border register, the border testing register, it can't imbue us with much confidence in the vaccine software that you're developing, right? I mean, how are you ensuring that you're not going to make the same kind of errors or bring in software which is patchy and hard for companies to use?
One of the things that the border worker testing register will do, and the functionality that will allow this is being added over the next week or two, is allow for better matching of vaccination records with testing records. So as employers all start to use the border worker testing register, providing the people who have been vaccinated have consented to their vaccination information being shared with their employer, that will be flagged up on the testing register. So when an employer goes in to look at their staff, it'll tell them when each of their staff members was last tested. It will also tell them whether their staff have been vaccinated. So it will provide them with a tool to make sure that they're ensuring that their frontline border workforce have been vaccinated as well. So making sure the two systems are interoperable has been a real focus.
I'll follow up because I think the question you asked was as well, part of your question was how can people be confident? These are currently two and will remain two separate systems. In fact, the COVID immunisation register, which has been used right from the start, is very good and it's been well received by the people who are putting the data in. It's having functionality added all the time, including the fact that if someone is vaccinated, that person's GP is notified that they have been vaccinated automatically. So the next upgrade of the border worker testing register, which is separate, which happens and goes live on Monday, will link up the data across the two, as the Minister said. So an additional function of the register will be to indicate the vaccination status of everyone who is on that register, if they have consented. And to date, just about everybody has consented for that information to be shared with their employer.
Testing of border workers has been an issue since August last year. How is this still a problem?
Look, I think what you'll see is that the vast majority of people are being tested regularly. The vast bulk of our border workforce are diligent in making sure they're being tested. There are, with any system that involves thousands of people, there is the risk that there is an issue at the margin with a small group of people. That appears to be the case here. So we've got an investigation now to make sure that it is only a small group of people and that appropriate action's being taken to follow up those particular individuals.
If that person hadn't got sick, how would we have known they hadn't been getting tested?
Ultimately, the work that we've been doing to bring to make the testing register mandatory, that had started before this case even emerged. So we would have been able to identify that once that process was completed. The other thing, as I said, is that standardised sign-in and sign-out, who's on-site process for MIQ, will also add that extra layer of protection. So when people sign into an MIQ facility now, for example, they're a contractor, an electrician. You know, one of the hotels rings up and says, we've got a fault, we need an electrician to come in. The electrician signs in. They will then be added to the testing register because there will have to be a follow-up test for them. So that process is becoming more automated. There are still a few bits and pieces that make it difficult. So making sure that we then get the NHI number for that electrician so that we can make sure that, that all of the data matching happens. There's still a manual process that needs to go through to make sure all of that information is accurate. The team are working to make sure they do that very efficiently.
I just go back to what you said before. You said it was a small group of people. How many people do you think that is? Is that they are possibly being supplying false information about their tests?
Well, look, as the register becomes mandatory, we'll get a better indication of whether there are any other people that have been doing that. The overwhelming evidence that we've seen so far is that people are complying and that they are being tested regularly.
Auckland DHB say that they urgently need those non-regulated workers. So now that the rules have been changed to allow them to give the vaccine, where are we at with getting that workforce working?
Sure, thanks for that. So yes, we made the decision that we would allow unregulated workforce, so particularly Kaiawhina, to be trained and then do the Pfizer module. So that work is underway. Both it requires a regulation change, which is happening, but also to develop and deliver some additional training for those Kaiawhina about immunisation generally, and then they will do the Pfizer module. We're expecting by the end of this month that workforce will therefore be able to start to be made available to district health boards as one part of their workforce, and in particular it will be important for when we do that large next scale up, which is in July.
In terms of the MedSafe changes around the temperature that they can be stored at, that approval, what does that mean in terms of being able to set up remote clinics? That's particularly important for Māori health providers who are trying to get kaumatua and Māori with comorbidities, vaccinated right now. When can they expect to have those vaccines in those freezers?
So at the moment we haven't had any logistic issues with getting the vaccine out, even in 2 remote locations. But what it will allow is for us to provide bigger deliveries out to district health boards that they can then repackage and do smaller deliveries from individual DHBs. I think that's the first thing. The second thing is it also is allowing us to relook at the role of general practice, because initially we have started already with GP hubs, but it also allows us to relook at whether we can use more general practices to vaccinate their practice populations as individual practices, not just through GP hubs. So that work is well underway too.
The government essentially, you talk about the people at the margins who, so we have a register, it's voluntary, employers are saying so many workers are being tested, but we don't know who's falsifying. You say it's a small number, but we don't actually know that, do we? We're essentially flying blind as to how many that might be because we're reliant on an information from the employers who aren't on the register.
I think if you look at the overall number of border workers who are being tested, and we report those every week, so there is a breakdown every week of the number of people who are being tested in different categories. So whether they're working in, at the border or whether they're working, whether they're people, returnees coming across the border, the number of people being tested each week corresponds with the number that you would expect with full compliance with the order. So therefore, the issue is going to be at the margins. So it's going to be, if that wouldn't identify if there were a handful of people who weren't being tested, but it would certainly identify if the problem was a large-scale problem, and it does not appear to be a large-scale problem.
On the CDHB vaccine supply issue, was that a case that they were over-ordered or under-administered? And if the CDHB was responsible for administering the vaccines, who's responsible for ordering them?
Well, I'll ask the Director General to comment in specific on that, but I want to just make a few comments about this that I think are important. As we go through this process of scaling up, there are going to be a few more unders and overs in terms of delivery on a day-by-day basis. Our wastage rate currently sits at around 3%, which is incredibly low. The World Health Organisation, for example, say to expect a wastage rate of above 10%. We're currently sitting at about 3%. The other point that I would make is where DHBs do, and whether it's DHBs, PHOs, or whoever's doing the vaccination, find that they have some vaccines that could be about to expire if they don't use them. If they find creative ways to use them, I would not only defend that, but I would encourage it. Ultimately, I don't want to have vaccines going to waste unnecessarily, and if that means that some people who might otherwise not get a vaccine a bit earlier, I'd far rather that happened than vaccines being thrown away. But I'll ask the Director General to comment on
just follow up on that comment. One additional comment is Canterbury DHB, as all DHBs do have, had a plan in place for if they had excess vaccine. And actually we saw this play out from the very first weekend that vaccination started in Auckland, you may recall, and so every DHB has a plan about how they can quickly call people in, and I think some of what I've read out of Canterbury is that not only did they call those people in, but those people who were called in were very grateful for that opportunity.
Can I make the point that the data on the Ministry of Health website doesn't appear to have been updated, which means scrutiny of those numbers can't happen for another week, which is bad, especially after the stonewalling in the Health Select Committee this morning. Like, there's just plainly an issue with transparency around this rollout. But my question would be, you said that 135,000 doses have been administered. How many people can we consider fully vaccinated and therefore immune to the disease? As in two doses and then the 5 days, whatever it is at the end?
I can give you how many people have had 2 doses. 30,194 people have had their second dose. So that's 105,391 who have just had their first dose so far, bringing a total of 135,585.
Who's been vaccinated?
You still get very effective coverage after the first dose. You still get quite a high efficacy rate. The second booster shot gives you an even higher efficacy rate. But 1 dose is certainly a significant advance on no dose in terms of people being protected by the vaccine.
Yes, and the updated data are going up this afternoon after the media stand-up and will include the information the Minister has outlined around the week-by-week expected vaccination delivery by DHB between now and the end of June.
It would be best practice to have that before the media stand-up, though, surely. Just as a point.
As I indicated, there is a detailed media briefing tomorrow, so that if you want to bore into all of that data, you'll be able to do that tomorrow.
My previous question, is the slowness of the rollout going to affect your longer term targets as to when other parts of the community will be vaccinated?
No, not at all. As I indicated in my introductory remarks, from sort of mid to late May, we start to get really move into that tier 3 group, which includes our senior citizens, those with additional health conditions, and so on. Our goal is to make sure that everybody has had the opportunity to be vaccinated by the end of the year. All of the feedback we're having is that our Pfizer deliveries are on track. We're expecting the big bulk of those to be starting to come in from July, which is why this plan really runs us through to the end of June, bearing in mind that in July we're really scaling up at that point to start delivering on a much grander scale, much bigger scale than we have been so far. I'll come over here.
Just quickly, Dr. Broomfield, on the kaimahi that could possibly be administering the vaccines, is there priority areas for Māori? Is it more of a priority to do it in Northland and Kaitahokianga areas than it is to train these people in Auckland? Is there thoughts on location and prioritisation of those resources?
Well, the priority will be in the regions where they have indicated that they could use this workforce sooner rather than later. So at the moment, the main focus for that is actually the northern region, including Northland, but also the Auckland Metro region is saying that they will want to start using this workforce before the bigger next scale up in July. Other district health boards feel that they are fine through to the end of June. So we will focus on training this workforce in the Auckland metro region and in Northland in the first instance.
The first three groups that you're going to vaccinate, they make up about 2.2 million people. And then in July, you're supposed to move on to the general population, which is another 2 million people. This plan you've given us today only has us vaccinating 1 million people by July 1st.
Yeah, so this is the rollout plan says when we start with different population groups, not necessarily when we finish with them. So it is to make sure that those who, we're rolling out by risk, but from July onwards, the rollout plan, the prioritisation framework, or the sequencing framework, I should say, get the phrase right, continues to be a guide, but from July onwards, we're literally just vaccinating everybody that we can possibly vaccinate. Within that, again, the sequencing framework is a guide for DHBs. They have the ability to make some pragmatic decisions. For example, if they're heading out to an isolated rural community to target a number of people who do qualify for a vaccine early on, and they're going to vaccinate the rest of the people who are in that small rural isolated community because it's logistically more sensible to do it in one go, they can do that. We ultimately, have the ability to be able to flex the system in that way, to be sensible. Everyone's going to get the vaccine. Come back up the back.
Just for a question for our Australian correspondent, are we doing anything, or do we have any plans to do anything to promote the use of the Australia state COVID apps in the line-up into the Australian bubble?
I know that the airlines are working on that in terms of building that into their safety briefings. So, for example, if you're flying from Australia to New Zealand, you'll get briefings on, downloading the New Zealand COVID Tracer app. That'll be built into that process. Similarly, I imagine that that's ultimately up to Australia to work with the airlines to have that going the other way. But we have worked closely with them to make sure that we're sharing good contact tracing information in the event that either of us need to do contact tracing where there is overlap.
Just going back to case B, when did the police get involved?
We do. The police are used during contact tracing investigations from time to time, where they can have access to information that might otherwise be difficult to access. So if we're reviewing CCTV, the police have regularly been involved in that process. They're very good at it, and they do that reasonably efficiently. So it's not unusual. I don't know the exact date.
From last Friday afternoon. One of the bits of information we were working on was that there was a difference between the information from the initial interviews with Case B about when they had been at work and what we might have thought was a sort of a fuller roster. So and also I should say there were also some language translation issues as well, and so we asked the police, as we have done before, to work alongside the public health unit team in Auckland to look at bank records which were volunteered up by the individual themselves, and phone records, just to help really get to the bottom and add their sort of investigatory skills to those of our public health teams.
I'm just conscious of time. I have to go and do this all over again shortly at parliamentary question time. So I'll do one last quick sweep for questions, and we'll just sort of work our way across the room. Anything further over here? Yep.
So MedSafe set to report back on the Johnson & Johnson vaccine tomorrow. Is there any indication that it's going to be stalled after it's been paused overseas? Is that information that they've gathered now out of date?
So I've had an update on that. So yes, the assessment committee met yesterday. It's formed an initial view. It's a long meeting, and that's all being written up. And I've asked overnight, because of this information from the US overnight, that they take a look at that and consider it. And so that will come in their final recommendation, which we will receive tomorrow. But I don't expect that it will prevent the Janssen vaccine necessarily from being approved, if that's the recommendation, but it of course may well add to one of the requirements on the process for its or a requirement on that approval.
Okay.
Be concerned about blood clots from the vaccine?
Well, concerned only in that they should know about it. Again, what I should point out is the Janssen vaccine is the same platform, it's the same technology as the AstraZeneca, and so there was already a high degree of close watch on that. They're very small numbers. and very rare, but I think Janssen's done exactly the right thing, pausing the rollout while it's looked into.
Yep.
Dr. Bloomfield, when is the next shipment of vaccines scheduled to arrive, and how many doses will be on that?
So the shipments are coming in weekly, and they're about 60 to 70,000 per shipment, and they've been arriving on time exactly as indicated by Pfizer each time. Yes.
Yep.
National's calling for the Epidemic Response Committee to return. They say the Health Select Committee has proven itself ill-equipped and ill-suited. What do you make of that?
Look, the Epidemic Response Committee was established when Parliament wasn't meeting. Parliament is now sitting regularly, question time is happening, select committees have the ability to ask people to appear before them. The written parliamentary question system is operating. We're doing this regularly. There is plenty of scrutiny of our overall COVID-19 response.
25 minutes on a briefing of the customer journey through MIQ is a good level of scrutiny.
Ultimately, that's what the select committee asked for.
The power imbalance there, it's not a good scrutiny of government if you're spending 25 minutes on a briefing and only 20 minutes on questioning.
Look, ultimately that's a matter for the select committee, but I would note that after this I go to parliamentary question time where I will be subject to opposition scrutiny. They get a regular number of questions. They get more questions now than we did when we were in the opposition, so they have plenty of opportunity to scrutinise the government.
They're calling for the committee to return. That's completely off the table.
Look, ultimately they haven't raised that with me, but I don't see the need for it. Yep.
At what point will you need mass vaccination centres? In particular, will you need them in time for this tranche? And if so, are they identified and in place?
Obviously, we will see a big scale up of the vaccine campaign from July onwards, and that will include some vaccination events, and preparation is underway for those. Whether there are any between now and then ultimately is up to the district health boards in terms of them meeting the rollout plan that we've set out today. Last question up the back.
You're happy, confident and satisfied there's been sufficient urgency and confidence in the way that the Ministry of Health has prepared the vaccination program, which we've known we would need since this time last year.
Look,
and appears to have got
this is the
underway in
largest
October.
vaccination campaign that we will do in New Zealand. It has required a lot of planning, a lot of preparation. Yes, it's new territory, having to do it at this scale, at this speed, with a vaccine that's complex like this one, ultra low temperatures, 2 doses, 3 weeks apart, and so on. So I've always been very clear there will undoubtedly be bumps in the road. I imagine when we get to July will be a reasonably bumpy month as we look to really ramp up to doing a very large number of doses on a daily basis. I'm fully expecting that, but I think if you look, our vaccine rollout has actually been going very smoothly. We have been able to learn from the rollout in other countries around the world, and taking our time at the beginning to get it right, I think will serve us well in terms of being able to finish when we need to finish.
The General announced a proactive investigation into the vaccine rollout about a month ago. Have they been providing feedback in a proactive way, or is there any aspect of the rollout they're particularly interested in?
I'll ask the Director General to comment.
So that bit of work is ongoing. I'm expecting their draft report within the next week or so, and then we'll have a couple of weeks to provide comment on that. So that's going to be another useful input and assurance mechanism for the vaccine rollout.
All right, thanks very much, everybody.